Hey man, AI Dr. Beeman, aka OB-GYN Kenobi here with another segment of Women's Health for Men and Women. Imagine you're sitting on the couch watching The Notebook with your lady and munching on some nachos. She looks at you and says you're chewing so loud that you're giving her a headache. So, being the caring, supportive partner you are, you stop chewing and ask her if there's anything you can do to help. But something doesn't sit right with you. You look at her and think, what an amazing woman. But those nachos were hella soggy. There's no way I was crunching loud enough for her to notice. So you start Googling stuff. Good. You're doing the right thing. So let me help you with some pointers on determining when a headache in pregnancy might be something to actually worry about. Now, first off, headaches are super common during pregnancy. Hormones, bad sleep, stress, chasing toddlers, all of it. Most of the time, not a huge deal. But sometimes, a headache is your partner's body throwing up a red flag. So here's what you want to watch for. First, if she's never really had headaches before and now she's getting them, especially later in pregnancy, bring it up at her appointment. Better safe than sorry. Second, if this headache feels way worse than anything she's had before or just feels off, not her normal kind of headache, that's a red flag. Here's something simple you can try at home. Give her Tylenol. That's acetaminophen, 1,000 milligrams. Totally safe during pregnancy for most women. If the headache improves after about 30 minutes, that's usually a good sign it's probably nothing serious. But if it doesn't get better, or it gets worse, time to call the OB. Now, if there's also swelling, high blood pressure, or a fever, that can be a sign of preeclampsia. Definitely call the doc. If she's confused, can't see right, has numbness, weakness, or, worst case, a seizure, don't wait. That's 911. Go. If the headache came on like a lightning strike, sudden, worst headache of her life, that could be a brain bleed. Again, call 911. If the headache changes depending on whether she's lying down or sitting up, that could be a pressure issue in the brain or spine. Definitely needs evaluation. And finally, in the third trimester, even regular headaches deserve more attention, because that's when pregnancy blood pressure issues can start. Bottom line, if you're worried, go to the emergency department or call your OB. If you're my patient, you probably have my number. Most of us docs would rather you give us a call than have to go to the emergency department if it can be avoided. She's got enough medical visits to worry about during pregnancy, so feel free to reach out if you're worried. Gentlemen, this has been Code Periwinkle, Women's Health for Men and Women, because although headaches are super common in pregnancy, sometimes the cause is more serious than the annoying way you breathe or exist in her general proximity.